Good afternoon, everyone, and welcome to our webinar today to talk about a COVID update. And we have with us here the Green River District Health Department Executive Director, Clay Horton. Dr. Dufresne from Owensboro Health will be joining us shortly. He has run into something he had to take care of and will be with us shortly. So thank you so much, Clay, for being here with us today. You've been with us since the beginning in March of 2020, helping us help our members navigate the changing complexities that seem to be happening day by day. And even though we all thought we had seen the worst of it, and we were all celebrating, kind of the new life and rebirth, here we are again, looking at our numbers rising. And I think today the map that I saw actually had a new color on it. I saw some actually black was on our color charts today for the state of Kentucky. So anyway, Clay, it's good to see you. Thanks for being with us. And I'll let you start off. And then we've got a lot of members that have joined us today and many questions that I'm going to go ahead and ask you when you're finished making remarks.
Sure. Thanks for having me again. Wish we didn't have to do this, honestly. Like you said, back in June, we were pretty optimistic that we were through this, but COVID-19 once again threw us a curveball, and that's with the Delta variant. We didn't quite have enough of society vaccinated yet. I think that with what we're seeing in terms of the tsunami of cases, we probably would have always had this Delta wave. But unfortunately, we're having worse outcomes than we probably should have. So I know Dr. Dufresne will join us, and he can talk a little bit about what's happening at the hospital. But the cases for probably the last 4 weeks have been rising at an alarming rate. I was hopeful that we were maybe been seeing some slowing down. I was looking at the numbers last night, and I thought maybe while they were still going up, they were slowing a little bit. But then the team did some work overnight, and this morning when I pulled that up, we seem to be on the same pace that we have been for about the last 4 months. So I'm glad to talk to your members. I think the business community is one of our more important partners. And we're at a point now where we have so much transmission in the community. Really, everybody needs to know how to take care of their organizations, how to take care of their people, and what to do when you have cases, and how to make sure your workplaces are safe. The health department, we're still going to be here to provide assistance, to provide some consultation. But when we have 400 cases a day, which is what we had last night, we can't provide one-on-one consultation on every case. So hopefully we've got some good tools out there. We've got some good information, and I'm glad to have the opportunity to talk with you all to answer those questions.
Thank you, Clay, and thank you too for being a part of the vaccine clinics. Every time we've called to ask you to do another with us, you've done that. You've gotten the staff and the resources, and I can't tell you how helpful that's been for us, because we're just trying to keep businesses open. We're trying to do our part as a chamber for our members. And I will say to our members that have joined us, if you all need on the fly questions, you can always text me or call me or email me, and I will work with Clay to get those answers for you. That's what we're here for. That's why you pay your membership and invest in our work, and we're just honored to be able to help you in any way we can. So the questions that I have today were sent in by our attendees, and I have not screened them. So some, these are questions from actual business owners. So I'm going to start off with this one. And this is more of an opinion-based question. Do you think more people will get vaccinated now that Pfizer is FDA approved, or more businesses will require the vaccine?
Well, certainly hope that more people will. I don't know. It seems like that a lot of the hesitancy we're seeing that perhaps that's just an excuse, because even though these vaccines were under an emergency use authorization for the last several months, we already had gobs of data that show that they were safe and effective. But hopefully, we had heard that objection a lot. So hopefully that will help convince some people that they are fully approved now. That's no longer an excuse. And if you have not gotten vaccinated yet, now is the time. So we know that they're safe. We know that they are highly effective in preventing infection, and they're even more effective in preventing serious illness and hospitalization and death.
So with regard to quarantine requirements, just a clarification, if you have an employee who has tested positive, so does that employee, can you tell me how long they have to quarantine away from the workplace?
Sure. So we use a couple of different terms. So first of all, if you've tested positive, you're sick, we don't use the word quarantine, we use the term isolation.
Okay.
Quarantine is the term we use for someone who's well, who's been exposed to someone that's sick, that we're trying to have them keep separated from everyone else in case they become sick. So we released last week some new guidance. This is really, in terms of isolation of sick patients, it's the same standard that we've been using all along. But we've tried to simplify it, streamline it, and make it easy to remember. But we call it 10-10-10 or the triple 10. I was calling it 10-10-10, and the staff pointed out to me that that's a fertilizer. So I've been trying to call it triple 10 since then. But if you test positive, you need to isolate for at least 10 days
Okay.
from other people. And the 10 days will start when symptoms are onset. So when you first become ill, that's when you start looking at the calendar. You also want to make sure that you're well. If you're still running a fever, you still have a serious cough, you probably haven't fully recovered and you would want to continue to isolate, but it'll be a minimum of 10 days. And then if you've not had symptoms, you start your calendar, you're counting your 10 days from the day that you take your test. So those are the two first 10s. And the last one is the 10 days for quarantine. We were previous to this asking people to quarantine for 14 days.
Okay.
With the Delta variant, there's a lot of evidence and a lot of data that suggests that the incubation period is a little shorter. So if you have been exposed to someone and you're not fully vaccinated, you should quarantine from 10 days from that last exposure. If you're fully vaccinated, as long as you don't have symptoms, you do not need to quarantine. You should wear a mask around other people. You should monitor for symptoms. And we recommend that you get tested 3 to 5 days after that last exposure.
So with regard to if someone in your workplace has tested positive and the team has been exposed to that person without a mask, is there benefit in having the team tested like with a rapid test, or will that rapid test not really be something that's going to work?
I'd mentioned the incubation period. So the incubation period is that period of time from when you're exposed to the virus until you become infectious or until we can detect the virus in your system. So there is value to testing, but you don't want to test too soon. So you want to test between 3 and 5 days after that exposure. If you test too soon, you may test negative and then you may become sick later.
And that almost provides a false sense of security. And we've dealt with that here at the chamber. You don't know when that window is and
Sure.
when you're going to be sick or when you're not. So with those new quarantine regulations, we will get those up on our website for our members under our COVID resource page. So if you do have questions on the quarantine and isolation time, since the Delta variant has changed the nuances of those two situations. Let's see. Are employers required or should they report employees who are positive?
There's no requirement for employers to report the positive cases. There isn't a requirement for the healthcare provider that provides that test and the laboratory that does the results. So those are reported to us. Generally, compliance with reporting is pretty good. Occasionally, we do hear of a case that is a provider that doesn't test a lot or they tested out of state. But in most cases, we're going to get the report here at the health department already, and the employer does not necessarily need to report that to us.
So this is a really good question and something we're dealing with. With the amount of information being disseminated by different organizations and individuals, it's challenging for an employer or workplace to know what's the best source. What are the top 2 sources where employers can get access to reliable information?
I think the top 2, first one would be cdc.gov. Right on their first homepage is COVID-19 information. There are hundreds of guidance documents for every sector. It's very comprehensive. A lot of it's been written in ways that are very easy to understand. Lots of infographics that you can use to educate your employees. And I think the other one would be the Kentucky Department for Public Health's website, which is kycovid19.ky.gov. So those would be the 2 that I would look at. I look at both of those every day myself.
And just so everyone knows, we do have those links on our website. So if you want to just go to our place and look at our COVID resource, we'll take you to those places by just the simple links that we have there for you. So you can go to us and we'll have the most updated information because we provide the links to those 2 resources. And thank you for that, Clay. Let's see. There was a question, are we still obligated to offer our employees 2 weeks paid COVID time off?
I don't think you're obligated to, and I think we are all reevaluating some of our policies. I think that and there are, um, there are advantages for a business to make sure that you're not compelling and forcing a sick employee to come to work where they're going to infect others and going to infect coworkers. With vaccines, if you're fully vaccinated, you're not required to quarantine if you have an exposure. So I've seen some employers that are still providing quarantine paid leave for their vaccinated employees, but not for those that have chosen not to get vaccinated. So I think those are different policies that our business places will have to evaluate and decide how to move forward.
That's good. Okay, thank you. So, and this has happened with so many of these things as just an employer here, we've seen, in our workplace. What are the current quarantine rules for vaccinated employees living with someone who tests positive?
So they still would not have to quarantine. Obviously, a household contact is going to be a higher risk contact. What we would encourage is that if they can isolate from each other within the home, they certainly should do that. But if the employee is fully vaccinated, they should wear a mask when they return to work. They should self-monitor for symptoms, but as long as they don't develop symptoms and they're wearing a mask, they are not required to quarantine. And then we would suggest that they get tested day 3 to day 5 after their last contact with the infected individual. And if that was negative, then life would resume as normal. But no quarantine, do wear a mask, and do monitor for symptoms.
Right. So what is recommended, and I know we have a lot of extenuating circumstances, but with this, I think it seems to be what we all have constantly are extenuating circumstances. What is recommended for secondhand exposure? For example, an employee's child is exposed at school. The child is primary exposure. The parents are secondhand. That would be the same thing you just said, right?
Right. Well, and the parents would not be required to quarantine. The child may be asked to quarantine because they had an exposure, and depending on the age of the child, if they're a little older and a little bit more self-sufficient, if they can isolate from the rest of the family within the home, that'd be a good practice. Eat their meals away from everyone else. In those periods of time where you have to interact, if everyone would wear a mask, that would reduce the risk. But in terms of other household members that did not have direct contact with the infected individual, quarantine's not indicated, and no other further precautions are indicated with them.
Okay, good. So what should be considered in a close contact in a business? What's, because we have customers in and out of our office all day here. What's a close contact?
So we define a close contact or someone who we'd ask to quarantine as someone who is within 6 feet of an infected individual for 15 minutes or longer. Okay. And then 15 minutes would be cumulative over the course of a 24-hour period. And then we would want to look at the period of time where the person was either experiencing symptoms, the infected person was experiencing symptoms in 2 days prior. So your coworker that you work right next to every day for 8 hours straight, you work with them Monday and Tuesday, and then on Wednesday they start feeling bad. Anyone that had been around them the prior 2 days for longer than 15 minutes should quarantine if they are not fully vaccinated. And again, that adds a qualifier to this advice every time, because the first year of this we didn't have vaccines, but now we do. So if you're not fully vaccinated, we'd indicate to be quarantined. If you are fully vaccinated, then you would just want to self-monitor for symptoms.
Good deal. So if we have an event and there's a vaccinated person in that event, which is, we have it outdoors and someone just tests positive that was at the event. If we have everyone that's socially distanced and outdoors, there doesn't need to be any kind of notification.
Right. So if they weren't, within 6 feet of each other for longer than 15 minutes, outdoors helps, obviously. That becomes hard to quantify, but no, we, at that point, we would not direct anyone to quarantine or take any special precautions. Okay. And I would just mention, we've got a lot of transmission in the community right now. So if you're out in the community interacting with people, there is risk there. So everybody ought to be self-monitoring all of the time now. Everybody ought to get vaccinated. But when we're talking about contact tracing in a business, we're really focused on those folks that were within 6 feet for a prolonged period of time.
Okay, good deal. So I'm going to let you talk for a moment. We have Dr. Kelly is trying to get on. He's now in the gallery as he's watching it and not as a presenter. So I'm going to let you talk for a moment, if you would, just about building occupancy. And, for any of several of our members had asked about, should businesses be looking at reduced building occupancy and reduced max capacity levels while they're back in the red?
Yeah, so I think in terms of when we're in the red, there are no mandated capacity restrictions anymore. But I think that there is lots of room for caution. There's lots of room for good common sense. So the things that we're asking people to do while we're in this red zone status is to encourage physical distancing and to maximize usage of outdoor spaces for gatherings. We know that risk outdoors is much less than indoor spaces. I think, as you're evaluating those situations and whether you need to reduce occupancy or not, you want to pay special attention to anyone that's in your facility that may be medically vulnerable. So if someone has, a condition like cancer or some other, they're taking medication that suppresses their immune system, you want to be extra careful with those folks. And if you have large, gatherings, large meetings, especially if they're indoors, you may want to consider doing some type of alternative, a Zoom, a virtual meeting, or postponing that type of meeting. The other thing is, our two biggest tools here is continuing to encourage vaccination, and then masking is an effective way to reduce spread. So, if you're not able to reduce occupancy, if you're not able to make some of these alternative arrangements that we were talking about, if you're going to have people indoors together, definitely make sure that everyone's wearing masks. That is an effective method, and it's not perfect. Vaccines aren't perfect, but when we use all of these things in combination with each other, our likelihood of spreading COVID-19 is greatly reduced. Okay,
great. So can you talk a little bit? We had some today, someone had posted on a social media account that, hey, vaccines here are free this weekend. And I tried to get directly to them to let them know that everybody gets free vaccines, that they're not,
sure,
not anything. And I'm going to let you answer that question while I go on and once again try to get OH on. I think they're having some technical difficulties. So I'll be right back.
Yeah, so that is a good point. Obviously, with the way that the vaccine rollout has worked, there is never an out-of-pocket cost for anyone for COVID-19 vaccination right now. Some providers may ask you to provide your health insurance information if you are insured. They are billing for an administration fee. But with all COVID-19 vaccines are being right now paid for by the federal government. Every provider that has signed up and enrolled to provide COVID-19 vaccines have agreed to not charge a patient or an employer any out-of-pocket cost. So if you find an event where they're free, great. If that motivates people who haven't gotten vaccinated yet to go and get vaccinated, we are fully supportive of that. However, there should not be a charge anywhere for COVID-19 vaccine, regardless of who that provider is.
Great.
Yeah, see, Dr. Kelly. All right.
Keep talking, Clay.
Yeah, Dr. Kelly, we actually had a picture of Steve Johnson on there from Montana. It was a fabulous picture, but so I didn't think he'd be a good presenter for this. We have several questions.
Nice background in here somehow.
Yes, well, thank you so much for joining us, Dr. Kelly. This is Dr. Kelly from Owensboro Health, and he's a Vice President of Medical Affairs. Dr. Kelly, we've had several questions that have been submitted regarding vaccinations. Clay's done an excellent job talking about really where we are at this point. But could you talk to the business leaders who are on this call, on the Zoom, and we'll watch it later, with regard to where our community is at this point with our COVID cases?
Sure. I actually have done this a couple of times today in different formats and to different people. And so I'll give you a general sense of kind of where I am. So the VPMA role for me is sort of the hospital CMO. So I'll speak specifically to the OHRH and then sort of broaden it to the system. We have 45 current inpatients in our hospital that have COVID-19. 12 of those are in our critical care unit, 24 of them sort of on the COVID floor, and then you say the math doesn't add up. So a certain percentage of those are no longer requiring isolation. So one of the cruelties of COVID as a disease when you get hospitalized is that it can result in a very prolonged hospital stay. And so when you get beyond 15 days of COVID, you no longer really in this hospital have to be quarantined. In most circumstances, for certain people who've had very severe illness, we wait till about 20 days. And that gives us a significant safety margin to feel like we can remove isolation precautions and that the people aren't infectious anymore. So the sicker you are, the higher viral load, all of those things for us in a hospital setting, we have to be ultra careful, and we are a little more, we extend that time period depending that you can get out of isolation compared to out in the community. So 45 patients here, and for perspective, at our peak back in December's and January, we were at 58 patients. That was our highest number ever at one given day. And we stayed in those numbers for, a period of time. And also, not to, bring the gloom and doom right out of the gate coming on, but we've had 24 patients in the month of August die of COVID-19 in Owensboro Health Regional Hospital. That is our third highest number of patients that have died of COVID-19 since the beginning of the pandemic, with the highest being in December and January of this past 2020 and January 2021, where we sort of hit our third peak and the biggest peak and the most overwhelming peak. So the numbers are starting to trend in that direction. When you go system-wide to Twin Lakes, and I know that we are sort of Owensboro Chamber of Commerce here, but that's a small facility of about 90 beds by license, but really probably only runs about 40 inpatient beds on a regular basis, maybe a little more. There are 15 COVID patients in Twin Lakes Medical Center currently, which is the highest number that they have ever had. And Muhlenberg, currently there are only 4, thank goodness, which could change, at any time, but that's kind of where we're at. So as a system, we're around 64 COVID patients. So that's kind of where those numbers are, what we've looked at, and in comparison to what we've had at our peak months back in December and January of 2020 and 2021.
Great. That's thank you, doctor. And it's great to have you here, particularly because you are a cardiologist, and a couple of our people have submitted questions specific to the heart.
Yeah.
This one is, what do you say to a person, this is kind of a long question. What do you say to a person who says the vaccine has not been tested long enough? Some of the vaccines for other diseases have been tested for many years. Examples would be the Ebola and polio vaccine. That's not one of the heart ones. The follow-up is cardiology.
Oh, that's all right. I can answer them all.
Yeah, that's right.
Yeah. I'm looking on my phone here because there's something I sent out to somebody today about this, and it came from a large health system called Sanford Health.
Uh-huh.
And the part of this is about that same question about what do you say about the vaccine hasn't been around. Honestly, mRNA technology and this types of vaccination have been around for a long time. And I've said this before, and I said this on previous interviews in different parts of the wave, that in reality, we had all funds going towards trying to find a cure for this. We had FDA removing red tape, which wasn't a bad thing. This is not like the safety margin part. We had money, we had all researchers, we had everybody rowing in the same direction to try to accomplish this. But the technology itself is older and has been around for a long time. If you look worldwide at the number of doses that have been given and the reporting system for adverse events, and certainly Clay can speak to this better than I even, the signal that's there for the side effects that occur are very rare events. They're events that occur almost within the margins of what normalcy would be for these types of events occurring in the general population. I don't see it. I don't get it. I'm a guy who's data driven, who spent the last 20 years of my life in training to get to kind of where I am and gone through this. And I don't see where people come up with these sort of barriers to getting it. So that's an easy thing. And I don't want to sound righteous on it, but there is no reason not to get vaccinated at this point, unless you have some of those religious exemptions, or unless you have some of those conditions that you can talk to your provider about. There are going to be a small percentage of people, maybe 1% to 2%, that probably have a reasonable approach to not getting vaccinated. But unfortunately, we're seeing many more than that 1% to 2% not wanting to get vaccinated.
Is there evidence that COVID vaccines change the heart in any detrimental way?
No. So some of that signal may be, and I'll qualify that a little more. Some of the signal towards young middle-aged men with certain mRNA vaccines getting myocarditis or some mild benign sort of chest pain or inflammation of the heart muscle. However, if you think about getting COVID-19, which has significant effects on the heart, causes thrombosis in your arteries and veins, leading to potential cardiac events resulting in death, getting COVID-19 and having the actual disease has significantly more effects on the heart and your organs than the vaccination, which is priming your body for a response to that antigen, that spike protein, which is just a minimal response. The people that did get admitted for any type of heart-related thing to the hospital had mild sort of self-limiting illness and really required limited to no intervention related to heart-related problems. Early on in the pandemic, I saw a lot, potentially some of the people's children on here who were athletes in the community, and I cleared them, as I put in quotation marks, for return to sports based upon the fact that they had COVID-19. We've gone through this by doing cardiac MRIs, stress tests, echocardiograms, taking a history, physical to decide how safe is it for this part of the population to then return to play after having COVID-19. And found that for most people, it is very easy for them to do after some time. And in the setting of getting vaccinated, there have been 0 people that have been sent to me to have to get any type of workup for cardiac conditions after a vaccination.
That's compelling. That's definitely compelling. So we're gonna go back out a little bit and ask a question with regards to testing. Is there a place to get free COVID tests when a person is showing symptoms? Clay, do you want to, Dr. Kelly, which one do you all want to take that?
I think we probably can tag team it. There are a number of people that are providing testing within the community. We do testing here at the health department. You could call the local health center 686-7744 to make an appointment, and we never charge for COVID-19 testing. If you have health insurance, if you have Medicaid, that would be covered, especially if the person was showing symptoms of COVID-19. I know the hospital has very robust testing capabilities and capacity. So Dr. Kelly can probably expand on that a little bit more.
It's the same general process that we've had all along. We've shifted it a little bit on the testing side, but our drive-through site that we have people come to and being able to sort of schedule openly online is the place that we do almost all of our testing at this time. Now, we started doing vaccines through that drive-through probably when we had a lull back in June or so. And so we're sort of testing that capacity right now based upon the number of people coming through, but we've expanded some of our staffing as we're able to expand staffing to be able to do more testing as needed. So I don't have the days and hours right in front of me, but we basically test 6 days a week, more or less. And then some days we do vaccines, some days we don't. It depends upon staffing, but we try to provide as much as possible. With the FDA approval coming for vaccines, with the fact that we've, now still testing all of our pre-procedure patients, vaccinated and unvaccinated, because you can certainly have a breakthrough infection even if you're vaccinated, although much less likely. That increases how many tests we do on a regular basis. But that's the basic area. The place that we do most of our testing is that drive-through site. And you sign up online and then you drive through, get swabbed, you go, and your results are typically for us back within 24 hours every day.
So with regard to the vaccinations, Dr. Kelly, and boosters, we've heard that now boosters are being approved and for people with immunodeficiencies. And also they said that with starting at your 8-month mark, your immune system or the vaccine defense, I don't know the terms like you do, but it starts to wane. Can you talk a little bit about the boosters and where you think we're headed?
Yeah, it's a very good question. It's been kind of rapid fire recently with all this. If you really think about the timing of when they came out and talked about people that have immune deficiencies getting a booster shot, and they wanted to almost differentiate the booster shot from the fact that they think that the 3% of the population, which is their number, that are in that immunodeficiency state that fit certain criteria with certain disease or long-term steroid use or certain types of cancers, probably didn't mount a very good immune response the first time around. So they almost wanted to say like, well, maybe they always needed a third shot to get that immune response, but let's just put it all as boosters to keep it simple. Within about a week of saying that they wanted all of those individuals to get their booster, it kind of turned and said, well, we're probably going to have everybody after 8 months get a booster. So it's kind of become like rapid fire. And I'm going to take kind of more of a black and white approach to it. I'm about 8 months out from my initial shot. I'm coming up on pretty soon my 8 months from being past my second shot, which is really the part that they're talking about. That's an arbitrary number. The data may support 6 months. The data may support 7 months. It's been happening in Israel. They've been giving boosters because they've seen breakthrough. We're seeing our breakthrough cases in people that it's a small number. It's not anywhere near the numbers in the people that are unvaccinated, but our cases, and Clay probably has the same data, are a lot of sort of people that December and January was when they got vaccinated. So I'm in favor of, as soon as you're able to get your booster, whether you're at 8 months, 7.5 months, 6 3/4 months, I don't want to split hairs. I don't have a set number on that. I think that you should get your booster if you want to get your booster as soon as it becomes available to you. I don't want people rushing here that had it finished 2 months ago and say they need it. But I think you're going to find that 8 month mark kind of creep back further and further here. And for me, I will probably, as soon as I'm able to get my booster.
Good deal. Good deal. So with regard to home testing, is the validity of home testing the same that it would be to go to a site and be tested on site somewhere?
Clay, you and I may differ on this a little bit, but maybe not. Clay and I used to talk almost every day, or I would see him maybe taking his morning constitutional walk, with his dog, as we were crossing paths. But we certainly have had a little bit of lull in those conversations, but not. Maybe it's coming back. So my general thought about over-the-counter antigen tests, such as like the Binax Abbott test, and those are, if you really look at the packet, it comes with 2, and they're antigen tests. So in the setting of symptoms, I think they're probably quite good. When you become more mildly symptomatic, or when you're in exposure, I think that it says to do them about 36 hours apart. So one test, and then wait, and then do the second test, and then if you're both negative, you feel pretty good about that. I'm of the mindset that you should probably have a confirmatory PCR test regardless, and that if your antigen is positive in the setting of symptoms, it's pretty good. But other than that, I don't put as much stock in over-the-counter antigen tests. There are some, although I haven't seen them on the counter here, over-the-counter PCR tests. But again, there are a number of what you call targets that these look at, which are little pieces of the sort of the genetic code of the virus. And PCR tests done in a hospital-based lab or a more complex lab usually have 3 targets, whereas over-the-counter tests usually look at 1 target. So again, you're just looking at multiple different ways to pick up a potential positive or a virus by looking at different segments. So we just get better sensitivity and specificity on the in-house sort of laboratory-based PCR testing that's done in a hospital-based lab. That's my opinion on those.
Like,
Yeah, I would tend to agree. I mean, the PCR is going to be your gold standard, and it's going to be the best. I think the rapid antigen test have a time and a place. Certainly, if you're symptomatic and you think, "Gosh, I'm always having a sinus infection, or I always have allergies," and you're just curious, and it's handy. If you can get a result in 15 minutes rather than having to go somewhere, schedule an appointment, get a test. I don't want to discourage that. So in terms of our data management and how we track cases, the home test, we won't confirm that as a COVID-19, whether that test is negative or positive. We don't really give official weight to that result. We do have people self-report from time to time, and our recommendation is always to get that confirmatory PCR test. And then, again, it's just, while there's trade-offs, there is an advantage to getting a result within 15 minutes. But definitely the sensitivity and the quality of the test is going to be much better with a professional laboratory.
So PCR, confirmatory PCR means going to the place and getting it done.
Yeah,
Yeah.
I would make one thing here, not that this is a, statistical class. The thing for me right now is, if you asked me this question in June, I'd have a different answer because there wasn't a lot of cases around. With the
Mhm.
positivity rate and the symptoms and how much is going around right now, I'm more comfortable with a positive antigen test. So because you're not testing for a disease that is only, a little bit in the population. It's a pretty prevalent disease. So the power of that test increases substantially when the prevalence in the community or the number of cases in the community goes up, which is where we're at right now.
So let's use that as a springboard to the next question. With masks, it is very prevalent in the community now. What would you suggest to employers inside the workplace with regard to masking for their employees?
I think that if employees are interacting with each other, or if they have to interact with clients or the public, right now, given the level of transmission in the community, I would 100% recommend universal masking in indoor settings. And if like Dr. Kelly was alluding to, where we have low transmission rates in the community, like we were in June, perhaps it's not, perhaps it's not something that we would recommend quite as strongly. But right now, given our environment, given what's happening in the community, without doubt, if you're around people that are outside your household, people you don't know their vaccination status, you should be wearing a mask right now.
I don't differ from that opinion at all. I recognize that it's tough for people to dial it back.
Mhm.
And, but, in the hospital right now, that's been the way we've been for 20 something months. We've gone away from trying to have in-person meetings in any manner, shape, or form, unless it's substantive to the end result. We're masking around people that we all know are vaccinated. When we had this little piece of the, a time when we were like, oh, we're all vaccinated in the room. We can take off our masks and exist in normalcy. But we've gone away from that because there's a need to just throw everything at it that we can, and that's masks and vaccinate.
Okay, thank you. So you all have seen, with regard to your workplaces, so a lot of stress, people who are being pushed to the limit that work for OH and the health department. And I feel like everybody thought we were almost there. And now this has happened. As a business community, as a community in general, what can we do in Owensboro and the region to make you understand how much we appreciate you and to make your lives and the lives of the people that work there every day better?
I'm going to defer to you, Clay.
Well, those kind. I think it's tough. I think that the community, the business community, the community in general, could be supportive, and I think the biggest thing that you can do is that if we could all speak with one voice, if we could do the things that the experts are recommending, which is encourage others to get vaccinated, to encourage masking as an effective way to reduce spread when we're seeing a high degree of transmission. Looking out, trying to, not in a confrontational or an argumentative way, but trying to address disinformation. We all have, within our organizations, we all have employees. Sometimes they hear things that are not true. There's a lot of bad information on the internet that sounds reliable, that's on social media that sounds reliable. But have those conversations, make sure that you're reinforcing the right messaging. And it's not necessarily taking a side here. It's necessary. It's what it is looking out for each other's self-interest, looking out for what's best for each other. So, I mean, I sound like a broken record. I am a broken record. It's vaccinate. It's wear a mask when you're out in the community, when we have high rates of transmission that we're seeing. Social distancing when appropriate, maximizing those outdoor spaces when you can. It's doing those things. There's no secret sauce here. There's no trick. It's just the same things that we've been saying over and over for months now.
I think that sometimes the broken record things comes up. I think with another thing that came kind of to fruition on Friday is that all of a sudden the FDA is going to approve this, right? And that brings up the question that people mentioned, did we just rush this through? So I saw data from a poll that was on LinkedIn earlier today that looked at, with the FDA approval, how many people changed their mind. And unfortunately, it depends on what audience or what echo chamber you're in at that moment. But the part that's interesting to me about that is that really on that poll, it said that only 2 to 3% of people would really would change their mind based upon the FDA approval. And then 7% still want more information. Nebulous, what is the more information that you need? But the thing that the FDA approval brings up for me is, for the businesses on here, is really there were businesses that you could say led or maybe didn't lead, depending on your perspective, by mandating vaccinations, if we don't want to use that term, or requiring vaccinations to keep operations moving or to keep yourself employed. I think that's a question for each business in and of themselves, depending on how they want to distill the data and how they want to look at it, and what they see as the big picture, and what they believe in is socially good, and what they believe is liberty, and what they believe is justice. I mean, there's a lot of philosophical questions inherent to that. For me, the idea that this has been FDA approved has been a rush is not true. I did not plan on getting vaccinated in the very beginning of this because I wanted to have more data and distill it. I probably read 300 to 400 different papers, like good, in-depth charts, graphs, to get myself, this is over 20 months, not in a short period of time, to try to get myself comfortable with feeling this way, to be able to answer this, that, and the other thing about COVID. As mentioned, I'm a cardiologist. I've become sort of this COVID virologist on the side about the methodology, how it works, the testing, all these other things. And while it's intellectually stimulating, it's an immensely frustrating issue to see the answer right in front of you and just not be able to drive it home. And there's always going to be a percentage of people that are not going to get vaccinated, but I don't feel like they should drive the rhetoric. And so for me, with FDA approval, with all the data that's out there, the data that I can provide on the number of people in our hospital that have died that are unvaccinated since April 19th, 36. The number of people that have died of COVID-19 that are vaccinated, 3. The number of people that ended up in the critical care unit, similar numbers, 95+% of the people that are getting sick, deathly ill, and dying from COVID are unvaccinated. That's just our internal story. That's our community story. That's not anything else on any social media platform. That's just what we live day to day here. And your staff, your neighbors, your family, your healthcare workers, and your facility that you either come to or choose another one, hopefully not, but we all have choices, is tired. We're just worn out. You can only go to the well so long. You can only incentivize or ask people to work another shift or ask people to just give of themselves for so long before the well is dry. And so those decisions are important as a community to make. And if you step inside these walls and you see what's happening in the hospital on an everyday basis and how people feel, because they may not tell you that when they're out there because they just want to disassociate from that, it's real tough in here. And the only way that we can expect any of that to get better is by decisions that are made outside of these walls. So that's kind of where we're at.
That's very well put. Thank you so much for sharing that and for your honesty and candor. I think we've got no more interactive questions that have come in. I don't know if you want to add anything else, either one of you. I think what you said, Dr. Kelly, put us off on the right note, and we'll all get out there and do our best to do our part. Thank you for your service, both of you, to our community, to our businesses, to our local economy, our regional economy. We're here just to keep things moving forward. So thank you both. And our next vaccine clinic here for the chamber will be at First Christian Church next Thursday. Brushover University is co-sponsoring that with us and First Christian. So Clay, thank you again for being on hand for that. I think at our last clinic, we vaccinated 80. So well done to the health department staff. That'll be next Thursday. But if you can do it before then, do it before then. We've always said before, we're not here to shame anybody or pass judgment. We're just here to keep things moving forward. Thank you both. Have a great day, and thanks for your service.
Thank you.